Today we'll hear the stories of individuals who have dedicated their lives to serving others through providing direct services and supports, through program leadership and supervision, through building best practices and evaluating those practices, and for working in our administration and finance teams. They are honorable, they are compassionate, and they're living their lives in such a way as to make a difference.
In terms of looking at the awardees this year, like the ABH membership, it's more than the sum of their parts. Really our field coming together, working together to better meet the needs of individuals, to offer hope, recovery, resiliency for individuals that we serve. And when I look at the ABH membership, that's what I see. All of us collectively working together to make things better.
I sit down with so many providers and hospitals where they talk to me about how behavioral health and mental health especially is a loss for them to provide. And it is our job in the State House and across the Commonwealth to change that narrative. There is nothing losing about taking care of people with behavioral health.
We're putting about $10 million into the ESP system, but only with very clear goals that we're looking to achieve on that, and to be pretty directive about, both on the hospital side and the overall system side, what we are looking to see in an actual system of crisis care.
I've always felt that public health, we have a particular obligation to ensure that we address the needs of people in vulnerable situations, and many times are unable to advocate for themselves. We know that many of the priority populations that we serve at BSAS, which are pregnant and parenting women, recently incarcerated, men of color, and the dually diagnosed folks with mental health and substance use issues, are our priority, and we need to ensure that they receive better and more integrated care. Those efforts start with you and our service providers. You are the unsung people doing the hero's work on the front lines day in and day out, ensuring that those who are often unable to speak for themselves adequately have a voice, have a chance, and have a pathway.
This is what describes you, all of you who are being honored here today. You refuse to accept the status quo. You apply your passion to finding better ways to reach all of the individuals who are so in need of excellent behavioral health. You reach out for partnerships to do your work. We thank you, not just today when you're being specially honored, but each and every day. Because here's what you show us. You show us that treatment can work, that healing can happen, and perhaps the greatest contribution we can all bring is to continue applying the art of the possible.
So congratulations on your achievements. Thank you all for your commitment in supporting recovery, resilience, and empowerment for individuals with behavioral health conditions. I'm happy to be here with you.
About 3 years ago, faced with a steady growth in our care management programs and the imminent rollout of a new state acronym, BHCP, we realized we needed some additional leadership for those programs. We're pretty proud at BHN that we've promoted most of our senior managers and leaders from within, but we realized we just didn't have a skill set that we needed. One of the applicants, Jessica DeFlumer-Trapp, had been working in Connecticut setting up behavioral health homes and population health programs. And hiring Jessica, as we look back, is probably one of the better decisions we've made in quite a while. In the 2.5 years since Jess started, our population health care management programs have grown from about 1,000 members to just about 5,000 members. And that includes the BHCP program, which just rolled out flawlessly, and I'm told that she actually says qualifying activities in her sleep. Along the way, it became clear that we had two sets of programs, our care management programs and our integrated behavioral health programs. We partner a lot with our regional health centers, and we had clinicians and recovery coaches and some family partners and other disciplines, CSP workers, working in primary care settings. And on the other hand, we had the new care management programs working in the primary care settings. But lo and behold, they weren't integrated. So Jess agreed to take those on, and at this point she's created fully integrated teams of care managers and clinicians and others who work with most of the regional health centers in Western Massachusetts. Jess has also been instrumental in negotiating and now implementing an alternative payment model to support the integrated behavioral health, and we are now have an innovative team that doesn't stick to just billing codes, but actually works on client-centered services based on what people need in their primary care settings. One of Jess's staff members said, "Jess is the embodiment of integration. She has a unique ability to bring a room full of dissenting professionals together by listening to their feedback, identifying a common theme, and realigning the group to a shared vision." Another team member added, "To many, the phrase integrated behavioral health doesn't mean much of anything. To me, that phrase means Jessica and the work she has done and the work she's about to do in our field." Jess, on behalf of ABH and its members, I'm honored and humbled to be able to present this inaugural Excellence in Integration Award to you.
Thanks, Steve, and thanks, ABH. Really, the opportunity to be up here and to be the award winner for this first award is just really humbling. I look out across the room and the people that I've networked with in between sessions. We're all doing the same work, and we're doing it together. So it doesn't really feel like my award. It feels like an award that really honors how far Massachusetts has come and the exceptional commitment of ABH and of EOHHS and other partners in the room to really do this work and do it well for the people that we serve. So I did, like Steve said, have the opportunity to join BHN just about 2.5 years ago. I was working down in Connecticut, and I got a call from one of my colleagues, Dan Olshansky, who's our Vice President of Clinical Quality, who said, "I want to tell you a little bit about BHN." He had gone up there from the state of Connecticut. "We're doing some really exceptional things." And I said, "Okay, tell me some more." And everything that he described to me just sounded like the Lamborghini of integrated care. And I thought, well, I can't miss an opportunity to do this. So I said, okay, sign me up. Give me the keys to the car. And the keys to the car really were 5 years of a labor of love of Kathy McGew, who's videoing me right now. Wave, Kathy. And Steve and Kathy Wilson, our CEO, who had this incredible vision for the importance of integrated care and primary care in the lives of people with behavioral health disorders. And so all I got to do really is walk in, take the keys to this incredible car that was already in place, and move it a little bit further down the line. So with BHCP and with Commonwealth Care Alliance to do One Care, and with the relationships in primary care, I'm thrilled to say that we have this incredible staff of people, nurses and clinicians, engagement and outreach staff, care coordinators, who every day are on the ground making sure that people with behavioral health disorders live happy, healthy lives that really takes into account their whole health. And so thank you very much for the award, and I look forward to doing more good work with the rest of you around integrating care for our folks.